Hello, welcome to Care. My name is Dr. Rahul. Today is October 1st, International Day of the Older Persons. I'm sure many of you haven't heard about such a thing, a specific day for older persons. Well, this month also happens to be, incidentally, the month of breast cancer awareness, and we have a lot of breast cancer survivors speaking about about the importance of screening for disease and trying and catching the disease early so that effective treatments can be instituted. Just like that, this month is where we geriatricians speak about importance of elderly care. We do that all the time, but this month gives us an extra plank and a louder voice to shout out with. Well, I'm a geriatrician. I don't know how many of you have heard of a geriatrician. You might have heard about a fetal medicine specialist who looks after unborn fetuses, looks after issues with unborn fetus. You might have heard about an electrophysiologist who's a cardiologist trained in issues, rhythm disturbances of the heart. Well, a geriatrician is focused on elderly care. Now, just like we look after, we treat common cold, headaches, pneumonias, COVID pneumonias, we don't stop there. We also look at issues like dementia, forgetfulness, psychiatric issues like depression, bipolar disorders, neurodegenerative conditions like Parkinson's. Well, one of the most commonest questions I get asked as a geriatrician is, what makes you different? How are you different from an internist who looks after any adult? Well, yes, we focus more on the functional status of the person. For example, you might have a 75-year-old person who was walking, talking, going to the shop, going to the bank, doing things by himself, had a pneumonia or a UTI, a urinary tract infection, got admitted. And then while during his hospital course, he deteriorates with respect to his functional status. Now you have his infection getting cured well. He's being treated with antibiotics and other medications. His infection is getting better, but he's becoming forgetful. He's not as alert as before. He's not as attentive as before. He requires assistance to walk to the washroom. He passes stools or urine on his bed. He needs assistance for that. He does not know where he is. So these are all things that I'm sure if you had to look after an older person, you would have seen such changes. Somebody who was reasonably very well has taken a turn for the worse so drastically with a seemingly minor insult, a seemingly minor infection or any other issue. That is where a geriatrician comes into picture. Now, our focus is not just to treat that infection. Technically, he's treated for the infection and he's done. But no, we focus on regaining the physical functional status of this person. If this person was walking by himself, feeding by himself, toileting by himself prior to this illness, our focus is to try and get them back to that state. Now, there can be a lot of reversible and irreversible causes. We look out for the reversible causes, try and address them, and try to get them back to their status as what it was before. We don't want a person who's come into the hospital walking, going back on a wheelchair, with support, or even worse, on a bed. We want them going back walking. And what does it take to take them there, to make them attain that kind of a success, is what we focused on most importantly. So there can be a lot of factors sometimes that are often missed by families. Supposing he could be having minor forgetfulness, mild dementia. It's not something as family that you tend to pick up because you see this person on a daily basis. It is very difficult to pick out subtle differences, and you need an objective assessment of these things, which is why we always emphasize that an older person, someone above the age of 60, is admitted for any reason. It can be a fracture, it can be an infection. Ideally requires an assessment by a geriatrician to see, are there any other issues that hasn't actually been red flagged earlier? Is there something else that we need to pick on so that we can prevent a complication later on, we can prevent an incident later on, we can prevent an issue later on, and a stitch in time saves 9. Pick it up early and try and correct it early. Well, stay tuned to this channel for more information. We'll be coming out with more videos, education material about issues pertaining exclusively to the older persons. Stay tuned. Bye-bye.